Hello, my name is Miro Mercigan, and this is my video assessment for heart, lungs, and upper and lower extremities. First, I will scan the room. Okay, the next thing I will do is I will knock on the door, check the chart, provide privacy, wash my hand, and identify the patient with 2 identifiers. Hello, my name is Meryl Mercigan, and I'm going to be your student nurse today. Can I please verify your full name and date of birth?
Mary Bordeaux, 6273.
Okay, do you have a preference of me?
You can call me Mary.
Okay, Mary, today I will do an assessment of your heart, your lungs, and your upper and lower extremities. Okay. First, I will ask you some questions. Do you have any history of heart disease?
Nope.
Any history of lung disease?
Nope.
Family history of heart and lung disease?
Nope.
Do you get headaches?
Nope.
Shortness of breath?
Nope.
Chest pain?
Nope.
Do you get dizzy, nausea?
Nope.
Are you exposed to any hazards at home?
Nope.
Or at work?
Nope.
Do you smoke?
No.
Do you exercise regularly?
Sometimes.
Okay, that's good. Okay, so patient has no history of lung and heart disease. So I will start doing my inspection. So first, I will do the front side of your listen to your heart, inspect, palpate, listen to your heart and lung sounds, and then I'll go on to the back side, and then we'll do the upper and lower extremities too. Okay?
Okay.
Okay, so I will start on the neck. So the patient's Mary's skin color is normal for her ethnicity. Her you okay?
Yes.
Her skin temperature is warm. The neck is symmetrical. There's no signs of I don't see any mass. So I will palpate your carotid artery. So just take a normal breath. So Mary's carotid artery is +2 and bilateral and strong and bounding. So I will listen to your neck for bruits. So I need for you to take a deep breath, and then after you exhale, just hold your breath for a few seconds. Okay. I will listen to this side and then do it again, and then I'll listen to the other side.
Okay.
For listening, for bruit, we use the bell side of the stethoscope. Okay, you can take a deep breath. Go ahead. Okay, I didn't hear any bruit on both sides of the neck. So the next I will inspect, listen to her heart sound. So the landmarks to listen for the heart sound is the aortic is on the right sternal border, second intercostal space. Pulmonic is on the left sternal border, second intercostal space. The Erb's point is on the left sternal border, third intercostal space. The tricuspid is on the left sternal border, fifth intercostal space. And then the mitral is on the mid-clavicular line, sixth intercostal space. So, Mary, I will listen to your to the locations that I just mentioned for you. Listen to your heart, okay? For this video, I will just listen through her skin on the aortic and pulmonic location. But for the actual patient, you have to listen listen through the skin, not through the shirt. And I'm gonna use the diaphragm for high pitch sound, and for the bell side is for the low pitch sound, such like if the patient has murmurs or other abnormal heart sound. Okay, S1 and S2 is, I heard the S1 and S2. The S2 is louder on the aortic and pulmonic location, and then the S1 is louder on the tricuspid and the mitral location. I did not hear any abnormal sounds like murmur. And it's loud and bounding. The rhythm, the rate and rhythm for the heart sound. So the next I will percuss for the at the front area of her body. So I will start on the second. I will percuss on the second intercostal space and on the fifth intercostal space. And I'll check for the dullness and resonance. Okay, on the second intercostal space, the sound is dull. And then for the fifth intercostal space, it's it's dull also. Okay, then I will start on the back side. You can see it. Okay, for the posterior side, the landmarks to listen for the lung sound or for the lung fields is C7 and T1, and then you find the palpate the scapula, which the bottom of the scapula is at the T7, and then go down to T8, T9, and T10. That's the where the lung fields for the posterior, and then going down lateral to the side is on the T8 location. So that's where I'm going to listen to her lung sounds in the back. So I'm gonna what I would do inspect her skin. So skin is normal. Again, normal for her ethnicity. She's warm. And then I'll do the tactile femidis first. Can you move forward a little bit? Okay. I need you to say 99, okay? As I go down to the lung field. Go ahead.
99, 99, 99, 99, 99.
Okay, the vibration is, there's more vibration on the upper part of her back, and then less vibration down here. And then I will palpate for crepitus. Okay, there's no, I did not feel any crepitus, there's no crepitus. And then I will percuss on the same location. Okay, during percussion, the sounds is dull. So now I will auscultate for her lung sound. So I just need you to take a deep breath, okay? Again, for the real patient, you have to listen to auscultate through their skin. But for the sake of this video, I'll just auscultate through her shirt. Okay, take a deep breath. Okay, I did not hear any adventitious sound. There's no rhonchi, crackles, or wheezing. So I'm going to check the patient's lung expansion. So Mary, take a deep breath. Okay. So her lung expansion is symmetrical bilaterally when she took a deep breath. So, okay, I need to sit down now. And I will auscultate the lung sounds on the front area too. Same location, the second intercostal space, and on the fifth intercostal space. Just take a deep breath. Okay, I did not hear any abnormal sounds or adventitious sounds, no rhonchi, no wheezing and no crackles. Okay, Mary, I need you to lay down and so I can check your upper and lower extremities. Okay. Okay, now I'm gonna check for her jugular vein distension. Okay, there's no distension on the jugular vein, so now I'm gonna have Mary to sit at a 45-degree angle. Alright, there's no distension as well. I did not see any distension on her jugular vein. And now I'm gonna check your apical pulse. And I'm gonna inspect it for about a minute, okay?
Okay.
Alright. Okay, so I did not see any heaves or lifts when checking her apical pulse. Okay, so now I'm gonna check her pulses on her upper extremities and lower extremities. So I'll start with the brachial. Okay, brachial pulses bilaterally is bounding +2. Strong bounding +2. Radial pulse is bilaterally as strong bounding +2. Then the popliteal. Okay, for the popliteal, bilaterally it's kind of weak. And then this is the posterior tibial. Okay, posterior tibial pulses is +2 bilaterally, and it's kind of faint. And then dorsalis pedis. Okay, dorsalis pedis is +2, bounding, and it's strong. Mary, I need you to... Now I'm going to test the patient's grip. Grip my hand. Try to push, pull. Alright. Same thing with your feet. Push and pull. Okay. So the patient grip is good, strong, and same thing on the feet. And you can set up now. And are you having any pain right now? Okay. So after assessment, I will what I will do is on a real patient is lower the bed, put on non-slip socks, raise the two side rails, and put on their bedside table and the call light closer, and then advise the patient to press the call light if the patient needs help with anything. And right now she's not having any pain, so and then I'll just document the finding and wash my hand, and that concludes my video.